We're going to talk about having a mental illness and then entering into the world of dating. Before we get into the dating part of it, I just want to clarify a few things about mental illness itself. This is not an umbrella term which sort of describes everybody. There are different types of mental illnesses from, I'm more or less fine, successful, functional, I have occasional panic attacks, to something where you're not really able to function or hold down a job or have contact with reality. Overall, I'm talking more today about the first types of problems, which are the neurotic conditions, where you might be experiencing a more intense emotion than others, more depression, more anxiety, more stress, but it's still essentially a relatable experience. The other type of disorders are psychotic disorders, where there's an actual break from reality, where it may not be possible really for other people to relate to what's happening in your inner world. So coming to dating with a mental illness, I think dating is hard. Finding a partner, figuring out whether they are the right person for you, that itself is difficult. Dating with a mental illness becomes even more complicated than that. I'm going to talk about some of the questions which clients typically ask under this circumstance, and broadly, half of these are questions about self. Like, can I really make this happen? And half of these are questions about stigma and how other people might respond or react to me and concerns around that. So about self, I think the first core and most painful question really is, am I capable of having a relationship? Can I be a partner to someone? On the whole, the answer is yes. There's really nothing about being depressed or being anxious which makes you incapable of love, or which makes you incapable of caring. Most of my clients are married. Most of them have families, children, parents, and they're doing pretty much everything a person needs to do in order to live a life. And so, it's not something which writes off relationships for you. However, because of your vulnerabilities, relationships can be a little more fraught and would need to be handled with a little more care. And we'll talk about that next, because, once I say this to them, the next question is, so what can I do to protect my relationship? I think the first and the most important thing here is to take responsibility for the symptoms of your problem or of your disorder. And when I say take responsibility, I don't really mean, hey, this is not your partner's fault, it's your fault. It's neither of your fault, it's the illness, right? But often when you're feeling depressed or when you're feeling anxious, you can kind of expect that your partner will take care of this and get upset with them for not being able to take care of it. And so that's what I mean by saying that let's understand that some things are coming out of an illness and not necessarily out of the relationship. This, of course, is not as simple as it sounds, because often, even for the person themselves, we don't know what experience is coming out of because I'm depressed, and what experience is coming out of because this is how I actually feel. And particularly in relationships, this can be very difficult. When you're depressed, you are likely to be more hopeless, you are likely to feel that the world is an unfriendly place, and this will get put onto your partner as well. And many times people feel like if I end the relationship, I'm sorted. So the next thing that people want to know is basically, so how do I protect my partner and how do I buffer them from the impact of the illness? So the first thing which I would suggest over there is that you take responsibility for your illness. Now what this means is that Sometimes if you're feeling sad, if you're feeling anxious, if you're feeling worried, even about the relationship, it might be coming from your mental state rather than coming from something that's happening in the relationship. It's hard to make this distinction for the people who are experiencing it, for professionals and for partners, to say which of this feeling is coming out of the relationship itself and which is coming because I'm particularly depressed today, I feel hopeless and I feel like things won't work out. So figuring that out, I think, and distinguishing between the two is important. The second is to take the appropriate help. Go for therapy if it'll help you. Try meds, they might work. And do something to help yourself get better. Whether it's like a mental health professional psychology route or whether you want to try yoga and clear up your nutrition, that's fine, but work on yourself. The third thing is to talk to your partner. Discuss how you're feeling. Discuss what you need from them. And remember that, sometimes they may not know what to do. And the more you can tell them that this is what works for me when I'm feeling low or when I'm feeling worried or when I'm feeling stressed, the easier it is for them to respond to that. And lastly, I'd say don't be very upset if your partner cannot fully enter into your feelings. It's not easy really to know what depression feels like if you've not been depressed. And some of the things that they say, which you may feel are insensitive or tactless, they are just talking from the knowledge that they have. And, if you find that that's how it is, try to deepen that knowledge by sharing more of your experiences. The other big question which comes up, the other two are a little bit more about stigma and about other people. So one question people want to know is, do I tell? Do I need to talk about this at all? I would say in general, if this seems to be a long-term committed relationship and you're thinking that you would like this to be part of your future, it makes sense to tell. This is not a secret that one can keep very easily. And I have seen a lot of heartbreak and trauma come out of, someone discovering later on. And your partner can feel very betrayed and they can feel very lied to and cheated that something so significant about yourself wasn't shared. So while you may be thinking you're protecting yourself, for your partner, it feels very different. In this whole telling thing, I see two patterns, both of which in their extremes, again, I think are not useful. One is this preference to sort of not say anything. I will hide and take the medicine. I'll just tell him I'm feeling a little tired. I won't tell her that, I'm actually going to see a therapist. When you try to take away this part of yourself completely, you feel more lonely, you feel more isolated, you feel more put upon because your partner is going to treat you like everything is fine because that's what you're telling them. And everything may not be fine every day. So you're making it really much, much harder for yourself, apart from the strain of keeping a secret and doing all that, which is definitely not good for intimacy in any relationship. The other extreme that people can go to is to lead with the disorder. There's some people where you feel the disorder enters the room a little bit before they do. And your whole identity gets wrapped around your diagnosis or your label. Now, this is something which I would say can be, again, damaging for yourself, as well as not great for the relationship. Because yes, you may have depression, but there is a you who is having the depression. And it's important to know that both are there. And to value and grow your healthy parts as well as nurturing your less healthy parts. So just as a person, I think it's important for us not to create identity around the disorder. In relationships, when we do this, what happens is if you do it consistently, people start treating you like you're ill. And that is again an unpleasant experience. And so finding a balance there, hard as it is something that's important.